Hello, my name is Sarah Heatbrink, and I am a graduate nursing student enrolled in the Family Nurse Practitioner program at Briar University. My evidence-based project is on developmental screening in primary care, and I am going to share my poster presentation with you. So the background and significance. Developmental and behavioral problems are prevalent among children, and the importance of timely detection of developmental delays is a very high priority for the American Academy of Pediatrics. There are numerous developmental screening tools that are available to primary care providers, but there is a lack of consistency as to which developmental screening tools are utilized, and specifically among the providers at the Sioux Center Health Medical Clinic, which is where I'm doing my clinical rotations at. So the question that I asked was, among primary care providers at the Sioux Center Health Medical Clinic, is there a need for utilization of a standardized developmental screening tool? The way that I searched for my evidence was through databases such as Medline, CINAHL, and UpToDate, and I was able to identify 10 articles on developmental screening tests. And I performed a thorough literature review on all 10 of these articles. Project design and implementation. The IRB of Briar University approved my project proposal, and then the clinic nurse manager and clinic providers at the Sioux Center Health Medical Clinic also approved the project. My project was comprised of a pre-survey questionnaire, an educational program, which was a PowerPoint presentation, and then a post-survey questionnaire. And so these questions that I asked in the surveys are listed here. And so from my pre-survey results, I handed out 8 pre-surveys and 6 were returned to me. All 6 providers said that they used a developmental screening tool. 4 of the providers stated that they used the Denver developmental screening test, which is a standardized screening tool. Although only 2 of these providers actually did utilize the test. So there was some confusion in regards to an actual standardized developmental screening tool as opposed to just developmental surveillance. The other 2 providers stated that they used the Denver screening tool that was built into the EMR. And again, this was not accurate because the questions that were actually built into the EMR at the Sioux Center Health Medical Clinic were more surveillance questions. It wasn't an actual screening tool that they were using. And the other 2 providers stated that they just use whatever is in Meditech, which is the electronic health record. So there was definitely some inconsistency that was identified there. So after my pre-survey results were gathered, then I completed a PowerPoint presentation. And so I basically just summarized, the problem and the importance of developmental screening in primary care and why it's so important to use an actual screening tool to identify developmental delays. And after the PowerPoint presentation was given to the providers at the Sioux Center Medical Clinic, then they answered the post-survey questions. And so that's where I am still awaiting my results. I've only gotten 2 of the post-surveys back at this time. So based on the pre-survey results, Only 2 of the providers seem to be utilizing a standardized developmental screening tool. Many of the providers are not aware that they were not using an actual screening tool. So my official recommendations for practice change is pending. Based on the recommendation of the American Academy of Pediatrics, a standardized developmental screening tool will be recommended after the post-survey results have been analyzed, and whether that will be the ASQ3 or the Denver Developmental Screening Test, I'm not really sure yet at this time, but according to the American Academy of Pediatrics, it's evidence-based and should be standard of care to use both developmental surveillance and developmental screening tools when caring for children in order to identify a potential developmental delay of some sort. So if you have any questions at all, just let me know. I have some references here and then my acknowledgement to Dr. Susan Beidler. So if you have any questions, let me know, and I hope you enjoyed my presentation. Thank you.